many members of the public with us. And we've got a very full board today. Apologies regarding the length of the board papers, which I think have excelled themselves at 478 pages. Thank you for all the teams who have put that together, and thank you for everyone who's read it. But we're going to start off with the Going the Extra Mile Awards, and I know I've got Faye with me, so we will start off with celebrating our wonderful SCBU team, the Special Care Baby Unit. And the SCBU team are a wonderful team. David Spraggett and I are the non-executive maternity champions. And so I have the pleasure of visiting our maternity and paediatric wards. But SCBU is very special. So Faye, I think you're here on behalf of the team. Lovely to see you. So I will just read out the nomination. The summer Going the Extra Mile Award team winner was awarded to the SCBU team. The team were nominated by a member of staff for being the most supportive, friendly and welcoming group of people. The nominator said, "I have been given opportunities to grow and make a difference in my role. The unit really does feel like a second family. This unit is the epitome of teamwork, from the ward clerks to the doctors and the housekeeping to the nurses. Everyone knows their role and works within their limitations to provide safe care, but also moulds themselves around the tasks at hand to provide the most effective care possible." The nominator finished off by saying, "I once read a quote which said, 'Do what you love and you'll never have a problem with Mondays.' And I can guarantee you this team all love what they do." Faye, thank you for your leadership. Thank you for everyone involved in the team. Please take back the board's thanks for the phenomenal work you all do day in, day out to look after those special babies. So thank you. And then our individual winner was Ode. I'm not sure if Ade is with us. Ade, are you with us? In which case I will just read out the nomination. Hi, MJ. Sorry, I didn't see you come online. So Ade is a senior plaster technician. I could do with a plasterer. And is our individual Going the Extra Mile Award winner for the summer, and was nominated twice from two different members of the public. One of the nominators said, "You don't see this very often, and especially someone who has worked in the same area for 33 years. An absolute credit to your department. Holds his title well as the Master of Plaster." The other nominator said, "Ade made everyone feel welcome and valued. He was compassionate and caring, and I genuinely believe that the Trust's values are intrinsically embedded in his approach to his patients." The nominator also noted that to see someone who clearly loves their work and genuinely cares about their patients is amazing. For me, Ade went above and beyond, and his approach to his work truly stood out for me. He is a credit to the hospital and to his profession. Ade, big round of applause from the board. Sorry you're not with us, but thank you very much for all your hard work. So, team, we will move on then to the board. Because of the papers are so long, I will keep things going at a pace. We've had a great board workshop this morning where we've been discussing our freedom to speak up work and our equality and diversity and inclusion work with Odo. And we were really, I think, as a board, pleased with the progress we're making in both those endeavours. But what I would like to say to members of staff who may be listening to this at another junction is the freedom to speak up is your right. We want to hear your voice. And managers and leaders should never be fearful of people speaking up. Speaking up is a sign of a healthy organisation which is open and transparent. And that's the way I want us to be. And on the subject of equality and diversity and inclusion, we talked about the things we should rightly do. because we are a significant employer, but we also talked about the things that define us as individuals and as an organisation. Can everyone please go on to mute? And our focus on EDI is at the very core of who we are. It's about how we treat one another, the respect we have for one another, and the value and contribution everyone can make to us as an organisation. We celebrate our diversity. We celebrate people's competence and character. That's what we're interested in as a team, and everyone's voice should be heard. We want to hear it, and we want to celebrate your hard work and efforts on behalf of the citizens we serve. So after that, we went into the more mundane. Oh, Ade, welcome. I've been celebrating you just before you joined the call. So sorry that you're late. It looks as though you're in the car. But Ade, we were celebrating you and thanking you for the wonderful nominations you had and the great work you do. I think one of your colleagues or one of the members of the public described you as the master of plaster. And so we've celebrated you already. But thank you very much for joining us, and you're very welcome to stay with us for the rest of the board if you want. I was just going on to describe that after the session on freedom to speak up and equality and diversity, we went to the equally important stuff of financing and finances and the elective hub work, which we'll touch on in the board papers. So without further ado, have we had any apologies for absence, Sarah?
We've got Gertrude and Alva's here, and Pranjit's going to be late.
Okay, great, thank you. And any new declarations of interest? Can colleagues please raise a digital hand? Can't see any digital hands raised, so I'll take those as an accurate record. So the minutes of the meeting held on the 4th of October, which Simon kindly chaired for me. Any points on the accuracy of those minutes? Could you please raise a digital hand? Can't see any digital hands raised, so I'll take those as an accurate record and we'll sign them in due course. And then on page 19 of the pack, we've got the action points arising. Both were with respect to the integrated performance report, and both of those were completed with actions coming back in March and February of next year. Are there any matters arising that are missed on page 19? Okay, so we then move on to the Foundation Group 4 board meeting from the 1st of November, and those minutes. If you weren't happy with the accuracy of those minutes, again, could you please raise a digital hand? So again, I can't see a digital hand raised, so I'll take those as an accurate record. And then, apologies, on page 38 of the pack, we've got the matters arising then. And I think most of those points are still in hand and work in progress. So we look forward to seeing those bear fruit. But I do think the arrival of Worcestershire into the Foundation Group is opening up new opportunities in terms of learning from one another, sharing on fragile services, particularly down at Wye Valley. So lots, I think, of green shoots in terms of positive reasons of having Worcestershire join us in our Foundation Group collaborative. Are there any matters arising colleagues feel I've missed from that? Okay, there's now a new section on the board pack for Chairman's remarks. I'll take the integrated care partnership update as read. Just a few things to make members of the public aware of things going on within our system. Things are clearly very tough, as Glenn will refer to, including the very disappointing news of another set of strikes to come after Christmas. But I really want to say to members of the public how proud I am of the performance of SWFT in what is very difficult circumstances, both in terms of the level of demand, the strikes that have gone on, and the enormous disruption as we continue our rebuilding work and redesign work with the elective hub. We've lost very little capacity with all of that redesign of our estates, and we continue to perform amongst the upper quartile on a series of metrics, which we'll cover off on the integrated performance report. So I'd just like to put on record my thanks to all of the teams operationally and at the front line. So thank you. And the final point I just wanted to make on here is to congratulate one of our colleagues in the system, Dr. Kieran Patel, who's the Chief Medical Officer at UHCW. Kieran has been offered the job of CMO at University Hospitals Birmingham and has accepted that position. And we wish Kieran well in that new role. So without further ado, I'll keep things moving and we will move on to some items for approval. The first is the Policy Review Group updated terms of reference. Adam.
Thank you, Russell. Just to note, the terms of reference have been updated with some minor amendments to clarify the reporting and policy review process, but otherwise the same.
Thank you, Adam. Any questions or perspectives on those updated terms of reference? If you're not happy to approve them, could you please raise a digital hand? Okay, duly approved. And then we've got the urgent decision provision for addressing the significant financial challenge created by industrial action. Kim, just a word of thanks to you and all of the teams in what has been a very busy period as you've had to redo our forecast. But what would you like to pull out of this part of the paper, which is we've had to make a decision, but this is for retrospective sign-off?
Yeah, no, just to confirm, really, thanks for everybody for helping us with that piece of work. It was a very tight timescale. So just to draw out for members of the public, really, that nationally there was £800 million released or allocated back to the NHS in order to recognise the fact that there are significant financial challenges on the back of 40 days worth of strikes, which wasn't obviously included in the planning round, and that did have an impact on our patient care, but obviously in terms of cost to ensure that the service was safe. In terms of what was actually devolved down to our system, 11.6 million was devolved to the Coventry and Warwickshire system, of which we received 1.6 million, which isn't nearly enough to cover the actual cost of or the lost income that we incurred as an organisation. So all organisations were asked to reassess their financial plans with a view to delivering the a break-even target. So what we've been doing is obviously work in the background to ensure that we can still deliver that requirement, and we have indeed confirmed that we're still on track. Now that's on the basis that there was no further industrial action, and unfortunately we heard yesterday that there is another announcement of further strike action. So that clearly is a further risk to us in terms of deliverability of that revised plan for the end of the financial year. We are delivering that break-even position in the context of using some balance sheet flexibility, non-recurrent means, and it's not without any risk, which I've documented in that paper there. But just to confirm, really, I think for the members of the public, we as an organisation are, we've reconfirmed the operational plan that we set out at the beginning of the year. We are maintaining our urgent emergency care. We're making sure that the safety of our patients is prioritised, and we're still maintaining that we are delivering our break-even duty, which is a statutory duty for the organisation. I think that's what I really wanted just to highlight, really, for the members of the public. Thank you.
That's great. Thank you, Kim. And Glenn, if you can just confirm, I think we are the only acute still in the Midlands with a break-even plan. Is that correct, or are there some others?
I haven't seen all of the updates, but some organisations have been given funding to achieve a break-even plan, so it's not quite like it used to be.
Okay, thanks, Glenn. But I think I am correct in saying Coventry and Warwickshire ICS is only one of two ICSs in the whole of the Midlands to post about break-even. Kim, did you want to come in before I open up for any other?
Yeah, just to confirm that's correct, Russell. So we're one of two organisations. So Coventry and Warwickshire system and Birmingham and BSOL system are the only two in the Midlands. The rest of the Midlands is forecasting a £645 million deficit actually together. So in terms of context, you know, financially we're doing well, but it's obviously got challenges within that. So just wanted to make sure that people understood that.
And thank you, Kim. The board have discussed this in sort of offline previously. Any questions at this stage from colleagues? I would just like to make a general point, therefore, about the impact of the strikes, and I imagine Glenn will come back to this. The strikes are enormously harmful to our operational capability, cause enormous disruption and affect patient care. I would like to thank those colleagues who, despite strike action, still come in, and those colleagues who aren't on strike, who take an even further step forward to support patients and colleagues in providing the best care we can. It's clearly a very difficult situation, but my primary concern is with the health and well-being of our staff and the citizens that we serve. So the sooner the strike situation is resolved, the better for all concerned. But thank you, Kim and colleagues, for all your hard work. Great news that we are as close to break even as we expect to be. Okay, colleagues, we'll move on then to the performance review and assurance part of our board report. And Glenn, the Chief Executive's report, what would you care to pull out?
Thank you, Russell. I'm concerned that Ade may get a parking ticket if he stays for the entire meeting. So it's genuinely okay if you want to leave us, Ade. At the end of my report, the citation that supports his nomination is there, which is great to see. So thank you. I'm just going to talk through a few bits and pieces in the report. Obviously, the first item of my report was referenced in the previous item, which is the NHS financial challenge. And it's obviously a little bit bigger than just the industrial action impact, with increasing demands on the NHS and inflation and a number of other factors. And that led to a series of negotiations between the Chief Finance Officer and the Treasury, which unfortunately didn't result in any extra funding. So whilst 2 billion was being asked for, the only funding that the NHS has had in addition to its initial settlement is that 200 million that we referred to in a previous board meeting. But what has happened is a share of that and some other funding has been allocated down to systems. So nationally, they've taken stock of the opportunity to freeze one or two other budgets to provide more funding for the front line. And as Kim just outlined, we were then asked to consider whether we could still deliver our plans, both in terms of the finances, but also the operational targets, particularly the elective recovery. So there was a suggestion that organisations may want to row back on the pace of the elective recovery programme. And I'm pleased to say that we are not proposing that we're going to do that, nor are other parts of the group. I think that would be counterproductive. I worry about those patients on the waiting list, but also worry about the impact that could possibly have on urgent care over the winter. So we are still continuing to deliver that. It will be a challenge, but we always like a challenge. So we have put forward that plan. Over the course of this week, there's a confirm and challenge meetings going on between systems and the national team. And I had one earlier for the Hereford and Worcester system. I have one tomorrow for the Coventry and Warwickshire system. But we expect our plans to hold firm at the end of those meetings. The mechanism through which we've been paid, Kim's talked about, there's a change to the threshold on elective recovery fund and an allocation for industrial action. We have, though, been challenged. Every part of the NHS has been challenged on the headcount changes. If you compare the headcount now to the headcount that was prior to COVID, so the 2019-20 year, and you can see increases in staffing across the NHS, some of which is quality related. So a good example of which would be maternity services headcount. But in other areas, there is a challenge as to whether that's delivered productivity improvements. And we will be showing our own numbers on that. We're certainly towards the lower end of the spectrum in terms of increases in headcount. And we can also point to quite big increases in urgent care demand, but also the fact that we are delivering more elective activity than in our original plan. So I think we're pretty strong in response to that. It's also somewhat disappointing that the autumn statement didn't include any additional funding for the NHS. I was particularly hoping that we might see something on capital, because capital, as we discussed in workshop this morning, is a constraint for us. And there's a number of projects that we would really like to move forward, particularly the future phases of the elective hub, which we'll touch on later. I then reference volunteering. It's great that we were talked about at the Chief Nursing Conference by Sir Thomas Hughes Hallett, who came to our full boards meeting last time. I also referenced there the Association of Groups work on leadership development and the intention for us to have a three-layered approach. So the leadership work that goes on within the organisation being supplemented by some forums across the group where we can do some teachings on some important areas of practice, and then being part of the Association of Groups and the ability to be part of some of their national networks of development. I then referenced the electronic patient record programme and the difficult decision that colleagues at UHCW took to defer their implementation, which has consequences for us. At the moment, we're not sure what their revised date is for implementation, and the current intention is that we follow on from that. We are, though, considering all options, including whether we wish to follow the implementation of the Cerner system. We have not signed that contract yet, and there are options, including whether we're part of the same instance with UHCW or whether we and George Eliot might consider having a separate instance, so we're not locked into a rather uncertain implementation plan. I then referenced the ICB board, and then an update from our audiology team. Huge amount of activity going on through there, and reference to their accreditation through UCAS, which is a great achievement for them, so well done. And then finally,
Glenn's frozen on my screen. Oh, Glenn, we just missed the finally, at least ways I did.
Did you miss me?
Yeah, you just said, and finally, and then you
and
froze.
finally, our GEM Award winners. So
Okay.
I won't read those out, but happy to take any questions. Sorry, Chair.
Thank you very much, Glenn. Questions or perspectives to Glenn? Glenn, when do you think we might be in a position to make a decision on the EPR partner going forwards?
I'd hoped it would have been by now, but we're still, as I understand it, UHW colleagues are still in conversation with Cerner regarding their own implementation plans. And when we hear that, that's when we can conclude whether we want to follow the originally planned course, i.e. we enter the same instance as UHCW. A slight concern, as I referenced in the report, is that it would appear that the way that has been built has now been frozen by UHCW. So we kind of would have to take the version that they have designed, and that may be adequate, but it may not meet our needs. So that's something we need to give some thought to.
Yeah, which is very disappointing. Bhaskar?
Thank you. Just to clarify, UH's decision itself has been deferred to just before Christmas. And from our end, we have obviously considered the three options that includes the two that Glenn said, as well as the third of perhaps reviewing the market again, even if it's at a very, very high level. So I think February is the deadline where we internally between SWFT and George Eliot Innovate partnership will make that decision, while UHCW's progress also facilitates that.
Okay, thank you, Bhaskar. Okie dokie, so if there are no further questions, we'll move on to the detail of our performance report. And Adam, do you want to introduce this for us, please?
Yes, thank you, Russell. So I think the key message for October is that we started to see the effects of winter, and that was reflected in the number of patients we saw across the trust, but also increases in, for example, sickness of staff with seasonal illnesses. In the detailed IPR report, the Chief Operating Officer includes a section on how we're planning for winter, and I think that's going to be particularly critical this year as we've seen the pressures begin to rise across the NHS and now the impact of the planned industrial action we'll see in a few weeks and beyond. So generally, October was extremely busy in terms of urgent care demand. In fact, it was our busiest ever month for average emergency department attendances. Clearly, there was therefore a knock-on effect on performance, although notably we remained in a favourable place for performance nationally, and I think that reflects the pressures across the country. Despite the pressures, it's reassuring to see our focus continue on quality. We saw increased patient feedback response rates and a great uptake of the new digital patient feedback tools that gives patients the opportunity to provide feedback quickly via text messages while still retaining the former paper-based forms for those who would like to use them. It's also good to see that the response rates are over 90% positive, and I think set in the context of the demand, capacity and waiting list pressures that we're seeing, that's positive. We of course strive for more, but I do think there's a positive picture overall, and the Chief Nursing Officer will discuss that further, I think, as part of the patient experience report. Kim's already talked about finance and will highlight financial performance in more detail as part of her section of the report, but clearly it remains an area of focus and challenge. We had a deficit at month 7 of 4.9 million, and clearly, as we've outlined, work continues to improve that position with further cost improvement scheme delivery in the coming months. We've also seen really good progress in areas of cost reduction, such as agency spend. And while we're not quite where we want yet, the sustained decrease in spend has been really positive there. I think it's really important to recognise the impact of the operational pressures we've already discussed and the onset of winter, which will have an impact on our staff. In months we've had positive, and I think recognise the hard work of our staff, but we need to really continue to provide that wellbeing support over winter. I think that's my overview, but I will hand over to my colleagues.
Thank you, Adam. So, thank you, Adam. So we'll pass on to Fiona and Charles first of all. Fiona.
Yes, thank you. So as Adam said, we're balancing the operational pressure and the finance position in terms of quality. We're not seeing a negative impact on that. Most of our quality indicators remain consistent and are at a good level, with some actually improving in month, particularly the friends and family response rate and the falls rate have improved marginally. Oh, and C. diff. So I'm pleased that we're balancing that well at the moment and not having an impact on patient care.
Thank you, Fiona. Charles, anything you want to add in terms of mortality at the moment?
Well, we've got the mortality report coming up, but the headline is that the shimmy has remained having reduced well in control limits. We have had an increase in our HSMR, but deep diving into this, it looks as though that is likely due to issues with our palliative care coding in comparison to other organisations. There are some other, groups that we're doing a deep dive into, but overall the situation is stable.
Okay, great. Thank you, Charles. Thank you, Fiona. Any questions or perspectives to Charles or Fiona? Glenn?
Fiona, just maybe one thing just to keep an eye on when we look at incident reporting for me is this concern about intelligent conveyancing, where we're seeing more ambulances coming into the area from other areas, and I'm concerned about the choice of patients sometimes, particularly where frail older patients have been brought into Warwickshire when they live elsewhere, and the difficulties then of discharge. I think it would be good just to track whether there are any harm events that we ought to be escalating as a result of that.
Yeah, happy to try and pull that out, but Glenn, but just as reassurance, I've organised a roundtable deep dive into the incidents that we have had, just to triangulate with our WMAS and ICB colleagues at a sort of governance incident event to triangulate whether we are, what the impact is, not only to the individual patients, but our flow and their experience and discharge as well. So that's in the diary, but I'm happy to try and pull out the figures in this report as well and going forward.
Okay, if Fiona, you can brief me after that meeting. I've got a meeting coming up with Ian Cummings, chair of WMAS, ambulance service. So if you could just brief me afterwards, that would be great. And then Charles, and then we'll move on.
Just to reinforce the point that Glenn's made is that, you know, the ambulance service do have criteria to not transfer frail elderly patients, and there are all sorts of good reasons for the patient and their family, and that doesn't always happen, and there is some pressure within the system to just take patients from, you know, other hospitals where they're having trouble to unload without following the criteria. So I think it's very important to hold the line and stick to the criteria that have been agreed, because ultimately, you know, if the wrong patient's in the wrong beds, the whole system suffers as well as the patients.
No, absolutely, Charles. Well said. Thank you. We'll move on then, with thanks to Charles and Fiona and your teams, to the operational overview. Harkamel.
Thank you. So as always, I start from a position of being really proud of what the organisation can achieve, because as has been said, October was phenomenally busy for this organisation. It was our highest emergency demand ever, and although we didn't hit the 76% standard, we placed really, really well nationally. And I think that's a really important point to draw out. From an elective perspective, our delivery was strong, so we delivered 113% of what we delivered in October 2019. And although it's not quite where we want it to be, diagnostic performance improved slightly as well. So we are going in the right direction there. Non-obstetric ultrasound remains difficult, but we do have a plan to improve compliance against that. The 62-day for cancer remains really challenging, and I've talked about the various reasons for that before. I just wanted to draw out the fact that we are getting support from the ICB, because many of our challenges are around those pathways where we need support from external providers. That said, though, we are doing really well on the 28-day standard. So 75.4% of our patients knew whether they had cancer or not within 28 days. And that is a really important metric. So I'm really proud that we're ahead of our trajectory there. It was also the second highest month for babies being born in the last few years, which I think it tells quite the story of what was going on at SWFT. And out-of-hospital performance remained very strong against all their key metrics. And that was really key in terms of getting us through October, which leads me on to my assurance update around planning for winter. So I used to give a separate report, but around what we're doing in terms of winter preparedness, but I've included it as part of this because I think October is a really good case study of what an organisation can achieve when it was really up against it. I've included a bit of a reminder about the approach that we take. So we have a winter planning board, and just by way of assurance, that's an operational, clinical and financial planning board that meets monthly. Essentially, though, it's really a forum to discuss how we deal with any of our pressures, because it feels like winter is sort of all year round. And I set out the ambition that we've set for ourselves to achieve the incentive scheme set out in the delivering operational resilience in winter that we were sent in July. But the bit I wanted to kind of draw out was just around what happened in October. So as we've said a few times on this meeting, October was really, really busy. We had a phenomenal number of attendances. The profile didn't fit what we've seen before. The day of admission was different. So all of our usual planning was sort of just a little bit off kilter. But we did really well. So to place, at one point in the month, we were top nationally, top regionally for our 4-hour performance for Type 1 organisation. We ended the month 8th nationally, which I think is brilliant. And the bits that I think really helped us were our same-day emergency care. So I've put in a chart around our growth for SDEC use. reduction in length of stay to inject some more capacity, much needed capacity, and also our virtual ward utilisation. The combination of all of it is really what helps an organisation retain that resilience, and it really is that pull out and admission avoidance, and keeping patients where they absolutely should be and cared for within their homes or coming from feels really, really vital. And I think that when you look at the demand that we were facing in October, the sum of all of the parts is the bit that managed to get us through as an organisation safely. And although not where we wanted to be, benchmarking really well nationally. So we've got a really good and strong bed of evidence, I think, to draw on. And we know which bits we want to invest in with our winter funding to get us through what we know is going to be a really challenging few months from January. We started that already. But it's also a phenomenal team effort and a really good reminder of what happens when everybody pulls together in the same direction and then leads us to where we were. So I hope that provides the assurance that the board are looking for in terms of our approach for winter.
Thank you, Harkamel, and thank you for the update, and thank you for your hard work and your team's hard work. Any questions or perspectives to Harkamel? My observation, Harkamel, I'd be interested in your perspective, is that despite all of those challenges you refer to, compared to where we were last year, my sense is the team are almost emotionally stronger. They're more resilient now to this. They're used to it, and they're responding to it without being proverbially, knackered all the time. They've got used to the rhythm of this type of stress and strain. Is that a fair perspective, do you think?
Oh, yeah, absolutely. So I think we've really embedded a robust governance structure. So we have daily exec check-ins with all of the teams at Silverham, and all of the execs sort of take it in turns to chair that, which I think is really important from a visibility perspective. But also there's a lot to be said for that triumvirate working. And that real divisional focus on getting everyone to do like their piece of work in their area. And Fiona, I think, has outlined it in her report in terms of that divisional focus on the staffing leading into the way that we make all of our decisions. I think that culture is really embedded. So people are really owning the solutions to their own problems, but also we have a forum daily where we can check in and just double check and ask for help should it get too difficult. And so we've been able to target, I think, the resource into the area that's most challenged and continue to sort of check and challenge where we're up to on a daily basis.
No, that's great. Thank you. Okay, and they sort of touched on staff wellbeing on that. Elva, what would you like to update us in terms of workforce, please?
Yeah, thanks, Russell. So just kind of the key highlights, really. Recruitment remains high, which is positive, and the indicators, and there is a recruitment dashboard within the pack as well. We can see some of the key performance indicators that we're reviewing ourselves against. And with our time to hire remains low, which is really good because we can get people in and get them unconditional offer letters a lot quicker, which means that we're not waiting for people to work their notice after doing all the checks. So that's been a really positive change in terms of getting people in quicker. That has also seen a significant improvement in turnover. And that's been consistently now since June 2022. We've seen a decrease, which is absolutely phenomenal, given all the pressures we've been faced with to have continual reduction in turnover. Although it's been quite small within the last few months, is still really positive for us, and something which the team have been working very hard on, along with Rebecca Badams, in terms of the kind of clinical retention group. We've established a flexible working group, and we're really seeing the benefits of those groups coming through now. The other thing just to touch upon is what we've kind of alluded to already around sickness absence. So as we would expect, we are seeing that increase in sickness absence as we're coming towards winter. And just to point out that our sickness absence data is pulled 6 weeks behind because of how our ESR data is pulled. So this is data referring to in September, and therefore we are anticipating to see that increase throughout winter, as we are seeing an increase in flu and COVID amongst our staff group as well. Apart from that, obviously there is a health and wellbeing update report as part of this pack as well for information. With all the great work that we've done in terms of health and wellbeing across the trust. And as Russell alluded to at the beginning of this meeting, we're doing a lot of work with equality, diversity and inclusion agenda across the trust, with a new EDI lead being appointed only a few months ago, and some really good plans of actions in place to ensure that we are improving our experience for our staff and patients throughout the trust. That's all. Thank you.
Thank you, Alva. Any questions or perspectives to Alva? Okay, I just encourage all of our staff to go and have their flu or COVID jab as soon as it's offered, just to make sure we look after ourselves over the winter period. And so we'll move on then to finance. And Kim, we've sort of touched on some of this, but anything you'd particularly like to pull out of your report this month?
Just a couple of things. Thank you, Chair. So this report was the month 7 position, which was written just before actually the further letter that we've received asking us to relook at our financial position. So at that point in time, we were reporting a £4.9 million deficit. As I've mentioned before, we've been doing a further work in terms of reviewing our forecasts and where we're how we're going to land the rest of the financial year with additional funding, etc. And we have confirmed that we will be trying to deliver the forecast break-even position. We're obviously managing that with the divisions in terms of F&P, making sure that we deliver on the cost improvement programme as we originally planned, and making sure that we're working obviously with the operational team, as Harcombe has alluded to, in terms of managing winter, to ensure that we manage together both the performance but also the safety aspects, as well as deliver on the money. So very much we work as a triumvirate, as an organisation, to ensure that we're making the right decisions for all of us as an organisation. Positive news: agency has reduced in second month in a row, which is really positive. So the work that Ellie in Fiona's team has been working on, particularly in nursing, has really shown some benefits, which is great to see. We do expect that to increase in winter, but obviously we have got these weekly meetings in place in order to make sure that we're using the appropriate level to ensure that we're safe, but obviously managing the money at the same time. I've mentioned earlier that we are likely to be using, unfortunately, more non-recurrent means in order to deliver our financial position by the end of the financial year, which does mean that I have concerns really around our underlying cash issue, which we have got mitigations in place, and I'll discuss those further in our confidential session. But those are the key things that I wanted to highlight to the board members and to the public.
Thank you, Kim. Any questions or perspectives to Kim? Obviously, the board are very close to all of the issues Kim's referred to. Okay, thank you very much, Kim. So we will therefore move on to the quarterly safe staffing report. And Fiona, over to you.
Sorry,
Yep.
I'm struggling to get off mute there. So just an overview, take it as read, but just to highlight to the board that I've changed the format of this report slightly this month, just to, as Harcombe was alluding to set the data around safe staffing at divisional level, so that hopefully the commentary you can see that looks at the risks within staffing within each of the division, then the vacancy and agency usage, and then the quality and safety KPIs. That I hope once I get used to this format, or we do, that we'll be able to triangulate within services that those decisions, the quality impact of financial, of agency, of vacancy position, and whether that is having an impact on patient care. At the moment, I'm comfortable that the quality, as I said earlier, is not being impacted, although as Kim's just alluded to, some of the divisions are holding high cost. And so those are being challenged now in terms of, can we reduce that cost without compromising safety. The two I'd pull out of there are the paediatric areas, particularly, and family health, and McGregor Ward and the complex children's team in the community are holding quite a high cost there. So that detailed work is going on behind the scenes. But otherwise, happy to take it as read and take any questions.
Thank you, Fiona. Can you thank Ellie? And because I know Ellie's been Ellie Ward has been a key individual in terms of helping you drive this forward. So can you thank Ellie as well? Any questions or perspectives to Fiona? This report, as Fiona's indicated, will mature over time, but I think it's a very helpful sort of evolution. Thank you, Fiona.
All right.
Okay, we'll move on then to the maternity governance report. Lorraine, we're delivering lots of babies, as was indicated earlier. Anything else? What would you like to pull out of your report?
Thank you, Chair. So this report is looking at Q2, so that ended with a very busy September of 302 births. But as we've just heard, October and November continue to be very busy. So historically, September was always the busy one, but actually it's continued. And if our trajectory continues, we will be way above our birth rates from last year. So something we need to keep a very close eye on with regards to our capacity. But obviously to say that consistently we maintained safe levels of care and outcomes for our mother and their babies, even with our summer pressures and doctor strikes. In Q2, unfortunately, we had 3 stillbirths, so our hearts go out to those families involved and the staff involved, and care has been provided. But our rolling stillbirth rate remains below the national average of 3.29, and we're rolling at 2.1 per thousand births, way below. And we had no neonatal deaths in the quarter either, and again, our rates are well below the national average. We continue to work with our concerns around PPH, our postpartum hemorrhage levels. We've done a very, very detailed deep dive into that, and we shared the headlines from that at the Clinical Governance Committee, and the report will go in due course, but all actions are put in place and we're working very hard. We've also worked with the LMNS actually to change the KPI for that and moved it from 2.5 to 3.7. We're still over that, but actually we're closer to that than we have previously been. Areas of concern remain around our theatre staffing, and that's still a challenge about our recruitment, and we are currently using agency to prevent any gaps in the rotas, but monitoring that very closely and have got a very detailed plan with that. We continue to recruit successfully, and we had 5 new qualified midwives start in the quarter, and our current vacancy rate is 4.18, so remains very low, and it's really pleasing that staff want to come and work with us. Currently as well, our sickness rates below are reduced, and our appraisal and training rates have increased, which is really great. Working very hard on our Saving Babies Life. We know that version 3 was released in May. We had our first review with the LMNS in August, and our compliance was at 57%, which was really pleasing considering that added another element into that. And we have got another review in November in preparation for our CNST and MIS submission, which is going to private boards today. We're working very hard with that compliance, and thank you to the team. Obviously, we appreciate we provide a lot of information for maternity that we need to do so for CNST, so we haven't attached it to this report, but actually all the papers will be available for you to see all of our action plans going forward, but happy to take any questions.
That's great. Thank you, Lorraine. Any questions for Lorraine? It's worth saying that every maternity department in the foundation group is rated now as good by CQC. But only SWFT is rated outstanding in terms of leadership. Conscious of the time, but Fiona?
Yeah, just one point for the non-execs around the table and the public. So Lorraine just mentioned that there was a number of appendices that have been removed from this report just to ensure brevity at board level, but that detail does go to clinical governance on a monthly basis and is available if anybody wants the more detail.
That's super. Thank you very much, Fiona. Okay, thank you, Lorraine. Please thank all the team. We love them all. It's great to have so many babies being born in Warwickshire. And I don't think it's going to go backwards. I think there are going to be more babies as our population grows. Need to pick up the time a little bit, guys. Apologies, but we do have an awful lot to cover. The Excel in Everything report, what would you care to pull out, Adam?
Thanks. Just a couple of points. So to note that at month 7, £10.5 million of savings had been identified, with just under 6 million delivered. And I think it's also important to note that 5.1 million of further run rate or cost avoidance savings have been identified and in the process of being delivered. I think that's particularly notable in areas such as the emergency division, where we know there's a high demand, and that cost avoidance work is really important. The report has a spotlight this month on a number of areas. So over the last month, we've looked at productivity. We've done quite a lot of work on managing our mobile devices spend. And obviously, we've discussed reduction in agency, but a particular focus also on high cost drugs and the costs there. Finally, during December, gluttons for punishment that we're starting the planning for 24-25. And have a workshop to be held there where we will look in detail at the schemes we want to deliver next year.
Thank you, Adam. Really great initiative, the Excel in Everything work. Any questions to Adam on that? Clearly bearing fruit. Keep up the great work. And we'll move on then to the patient experience quarterly report. Fiona, you touched on some metrics on this earlier. What would you care to pull out?
Yeah, just take the paper as read, sorry, with the only comment really being that one of assurance that despite the activity we've had over the last quarter, we haven't seen a subsequent increase in complaints or PALS responses. In fact, they've gone down. So I'm really assured that the patients are still getting a high quality of experience within our clinical teams. One thing, just as a continued focus at divisional level, is the response rate for our complaints, which the management teams are working on.
Okay, thank you. Any questions or perspectives to Fiona? Just whilst we are on the subject of patient experience, I just would like to say a few words about Jeff Rain, who was a key member of the patient forum, who has passed away in the last few weeks. And so our hearts and thoughts go out to his family, as well as to Michael Piper, who has been an absolutely key member of the patient forum. Michael's a wife, I know, has passed away also in the last couple of months. And so, Michael, you're in our thoughts. So patient forum, an incredibly important forum. We touched on the subject of volunteering earlier. If you're looking to volunteer, being a governor is a great way to volunteer. Being a member of the patient forum is a great way to volunteer. And reaching out to Sharon Ellswood, who coordinates all of our volunteering activity, is a wonderful thing to do. It gives a real a sense of purpose to you. If you're looking for something to do, maybe you've retired, wondering what to do with yourself, volunteering at SWFT, we'd love to have you. But for Jeff and Michael and their families, very much in our thoughts at this time. The medical revalidation report. Charles, what would you like to pull out? Charles, you're on mute if you're talking.
Sorry, I was just trying to get off mute. I think this is a very assuring report, and I'd particularly like to compliment Emmett White on the work he's done with revalidation and the audit of it. I think we have a very sound, well-assured system with appropriate number of appraisers, every appraisal validated, tie-up between complaints and incidents. The only thing I think that would be nice to have would be a peer review. You'll see in the actions, but otherwise I think we're in a good position.
Thank you very much, Charles. Any questions or perspectives to Charles on medical revalidation? Okay, thank you everyone for their hard work on all of that. So we will move on to the subject of the 6-monthly update on the Trust performance against national guidelines on learning from deaths. Charles, we touched on mortality a little bit. Anything you wanted to add at this stage?
I think it's already been said. Essentially, stable position with the shimmy, rise in HSMR, but some work to understand that.
Okay, and the long-term run rate on deaths is now reduced to a more sensible level after all of the experiences post-COVID. I think that's correct, isn't it, Charles?
Yes, it has.
Yeah. Any questions to Charles on the mortality report? Okay, so we go into the Digital Health Board, and members of the public, you get a flavour when you see the different variety of reports about the unbelievable amount of work that goes on to try and deliver safe care from everyone who works in the trust. I can't, as I said in my introduction, thank our frontline teams enough. And this is another example. So the Digital Health Board and EPR governance report, Adam?
Thank you, Russell. Just a few highlights. Clearly, a section of the report focuses on the EPR, which we've already discussed. Absolutely fundamental to us in terms of our digital strategy. So a really key area of work and an area of concern for the reasons we've discussed already. That said, there is a lot of other work going on. The report covers the major infrastructure work we're doing to relocate to data centres, which will provide increased resilience for our network, as well as other work such as the implementation of the voice recognition system, which will ultimately improve productivity for our staff. There's lots of other things going on. I think I particularly want to highlight to board members and members of the public the focused work that we're doing and which has been reviewed by Digital Health Board on digital exclusion. We've discussed and had this raised by governors at previous board meetings, but I wanted to provide some assurance that this really is an area of focus for us, and that we are ensuring that where we introduce new digital tools, that we make sure we have relevant manual-based or paper-based systems for those who are unable or don't wish to use them. And we're particularly embedding that in the new innovation work that we're progressing through the Digital Hub.
No, thank you, Adam. There's a somewhat amusing advert at the moment in terms of getting yourself a more complicated password to accept, enable your risk of fraud to be reduced, and it tells you to look around and see 3 things around you and then make that your password. The problem is, if I did that, given I moved from room to room, I'd keep on forgetting what the blooming password was. So really great to hear that work on digital exclusion, because we have discussed that a lot in the past. Any questions or perspectives to Adam or Sue?
Yeah, conscious of time, but I just wanted to come back on EPR. I appreciate that we're looking at all options are back on the table, and I'd really like to see the options come back to confidential board as soon as possible because of the system's risks associated with these huge projects. And in terms of the options that are being looked at, I heard that the incident that's been created has been locked down, as it were, in terms of localization. But if we were ready to go first, are we looking at one instance, i.e. using the work that's already been done and adding on our localization? Could we go first?
Yes, so that is one of the options that's being reviewed. So effectively, as part of our options assessment at the moment, we're doing our due diligence on the work that UHCW have already done, and making sure that could either work for us as is or could be added on to in a way that met our organisational clinical needs. And given we have an approved business case for that, providing we could get that to work for us and we could get the governance to work between the organisations, that would be the way to go. But there are questions we obviously need to work through to make sure those factors are appropriate for us, and that will come back in the options appraisal, and we'll make sure that confidential board sees that, as you say, Sue.
We are running late, but quickly, Kim.
Oh, sorry, Russell. I just want to mention about the digital exclusion, just bearing in mind the discussion around EDI, because sometimes it might not be the fact that people are not able to use digital tools, it might just be a language barrier. I use my mum as an example. You know, she's very digitally aware, but actually everything's in Chinese. So just bear that in mind, please.
Yeah, no, and that I think is a real, a very real issue, and I think it's well made, Kim. Thank you. Okie dokie, we'll move on then, and if we can canter through this, it would be great. I'll take the report from the Council of Governors meeting on the 9th of November as read. Any questions on that? We'd just like to thank again all of our governors for their hard work. Mary Malloy in particular, who stood down now as our lead governor, but Mike Wells, who's kindly stood up to the breach. So thank you, Mike. I believe you're both on the call. Can't thank you enough, Mary, and look forward to your contribution, Mike. The Audit Committee of the 11th of October. Anything you want to pull out of this, Richard, or can we take it as read?
Take it as read. That there are only two things, which is really Gertie and Elva done a fantastic job with the risk approach to recruitment. And you know, the key stats we found is that time to hire is reduced by 70%, and the withdrawal rate has dropped by 80%. So that's had a fantastic benefit to the organisation. And the only other item was that with the aseptic stock control is under review. There's lots of ideas, and everybody in the organisation are going to revisit in coming months.
Thank you very much, Richard. Any questions to Richard? Okay, great. And then we're on to the Clinical Governance Committee of the 11th of October and 8th of November. David, anything you want to brief us on?
No, I'm happy for it to be taken as read.
Thank you. Any questions to David? Thank you, David and team, for your hard work on that. And then the Foundation Group Strategy Committee of the 17th of October. Anything you want to say, Simon, or do you want to take it as read?
Take it as read, Russell. I just think it's a good illustration of the breadth of discussion taking place in the bigger group. But take it as read.
Super, thank you. Any questions to Simon on the Foundation Group Subcommittee report of the 17th of October? Okay, thank you. So we then move on to our progress report on the annual Trust and Foundation Group objectives for this year. Glenn.
Yeah, thank you, Russell. So this is the report which demonstrates progress halfway through the year. This is the same report that went to our Public Council of Governors meeting, where I took a number of questions and went through a bit more detail. So I don't intend to go through the detail here. You'll see that the individual executive leads have RAG rated the progress. I could challenge the optimism and pessimism of some of those ratings, but generally marks some really good progress actually against some challenging objectives in a difficult time with all the other things that we've talked about on this agenda. The only one RAG rated is the electronic patient record implementation, which we've already reported on. Happy to take questions.
I agree, Glenn. I think it's a pretty positive picture in what is obviously turning out to be a difficult year. Any questions to Glenn on that update? Okay, thank you, Glenn. Thank you, team. Therefore, we've got some items for noting. The first is a summary of ratified policies. Adam?
Nothing particular to draw out, Russell. 2 ratified policies this month as per the report.
Okay, any questions for Adam on that? It's just for noting. Okay, thank you, Adam. Then the security standards 6 monthly report. Harkamel, how's the martial arts going on the aspect of security?
I think we're okay. It's a brief report. It's just for information, and we now only have 6 standards that are partially compliant, and there are details of the gap analysis in the report.
No, thank you, Harkamel. Any questions to Harkamel on the security standards report? I touched on it a bit today already. The health and wellbeing 6 monthly report. Elva, anything you particularly want to pull out?
No, I take the report as read. Happy to take any questions.
I am very proud of the work that's been done on health and wellbeing. I think it's a very broad church of work. So well done, team. Ollie?
Yeah, just a quick one really to Elva is how's the EAP take up? Because that's going to be a key area of prevention for poor health and wellbeing.
Yeah, we can get you the breakdown of that, but the take up of that is very good, and we particularly work with our psychological support team as well, in order to use that as a bit of a triage in terms of support for our staff as a first port of call. So if you want the stats, I can provide that to you outside of here if you like, Oliver.
That'd be great. Thank you.
No problem.
Thank you, Oliver. Thank you, Ollie. Any other questions to Oliver? And then we're on to the nutrition standard 6 monthly report. Harkamel.
Yeah, so this is the first time I'm bringing this one here, and it'll come here every 6 months following standards that were introduced a year ago. There are 8 standards that we have to meet, and the report outlines the detail and the areas of activity that have taken place that provide assurance. There's lots and lots of good bits in the report. The bit I wanted to just pull out was that Warwick and now Leamington both have a 5-star hygiene rating, which is excellent.
No, absolutely. Can't recommend our canteen strongly enough for visitors and families. Not quite as good as IKEA used to be in Coventry if you enjoyed meatballs, but nonetheless our canteen serves a great variety of very nutritious food. Any questions or perspectives to Harkamel? Okay, great, thank you. And please pass on our thanks to all of the team involved in delivering that day in, day out, because I know it is. The Summary of Infection Prevention and Control Annual Report. Fiona.
Yeah, so this is a summary, and the much longer report has been to the Infection Prevention Board and Clinical Governance. So, if anybody wants that fuller report, they can have it. But I think just a recognition that the Infection Prevention and Control agenda had another positive year with COVID gave us a lot, didn't it? But actually, there was some positives that came out of it, and one of them is that infection prevention isn't just owned by the infection prevention team any longer. The whole organisation recognises what can go wrong when we lose control of infection prevention, and how important compliance is and monitoring. So we are good at SWFT at infection prevention. The only challenge at the moment is our bloodstream infections in terms of numbers, but actually it's a challenge every day to balance how busy a hospital and our services are, and remember to wash our hands and do the basics that prevent infection. So thank you to the whole organisation, I'd say. I usually say to the IPC team, but I think actually it's owned by everybody now.
I agree, absolutely, Fiona. Well said. Thank you. Any questions or perspectives to Fiona on the IPCC report? Okay, keep up the great work, team, on the front lines. It's each of our responsibility in terms of prevention and infection. The updated register of directors' interests. Sarah?
Thanks, Russell. Happy to take the report as read. It just includes some updates from Richard Colley. Thank you.
Okay, any questions or perspectives on those? Any final changes? Okay, duly noted, thank you. And then we put in a paper on the non-executive director committee membership, just so colleagues are all aware of what one another is doing. There are other things that directors are involved in. For example, David and I as NED maternity champions. Ollie Hisco has just become the NED volunteering champion. So all of the NEDs are kept busy, I think almost all of the time. Any questions or perspectives on that report? Okay, super. Thank you very much. So the audit committee and other board committee minutes. The audit committee of the 13th of September. Richard, anything you want to pull out of these, or just take them as read?
I'll take it as read. So
thank you. Any questions on those minutes? Okay, duly noted. Thank you. The Clinical Governance Committee of the 13th of September and 11th of October. David, anything in terms of those minutes?
The only thing I want to say is that it's not my signature on the bottom of the 13th of September minutes, so that needs to be amended.
Someone trying to forge the elegance.
They made a very bad job of it if they're trying to forge my signature.
Say it. The elegant scribble, which is your GP signature. Thank you, David. Let's make sure we slap someone's hand for doing that. Any questions for David on those minutes? I have to say I've got probably the worst signature of anyone on the board. And so I think then, colleagues, we're on to any other business. Any other business? Please raise a digital hand. Bear with me. We'll come back to questions in just a second, Mike. Okay, so we'll move on then to questions from governors and members of the public. We've got some which have been submitted, but Mike, your hand has enthusiastically gone up. As our new lead governor, I'll allow you to go first. Mike?
Yeah, sorry, Russell, over enthusiastic as you say. So in the Exhol for Everything update, there was mention of a pharmacy transformation board, and Councillor Governors at its last meeting had a pharmacy update. So we know what we've got to do locally, but I wondered, with SWFT's position as an anchor institution, is there anything that could be done to help community pharmacies, and particularly out of hours palliative care drugs?
Yeah. Charles, I know you've been involved in this a bit. Charles?
Yes, there is a problem with the provision of community pharmacies in their ability to dispense controlled drugs out of hours, and so a small number are contracted in. So it's really a piece of work that the ICS are planning to do to try and increase the number of pharmacies that will dispense controlled drugs at evenings and weekends. In the meantime, because of the importance of getting drugs to these patients, the SWFT pharmacy with SWFT Clinical Services have made some special arrangements to be able to dispense the drugs out of hours, but clearly it can be quite a journey, and is not the optimal way of doing it. We did explore trying to have grab bags, but because of the controlled drugs legislation, the drugs have to be actually prescribed for individual patients.
Okay, thanks, Charles. I mean, this is a genuine issue, isn't it, for
absolutely
patients in a palliative situation and their families. A scenario, 2 o'clock in the morning, your loved one is in real pain, you're trying to find someone who can dispense the drugs to provide them comfort. So Charles, I've got a chairs meeting next week. I'll take that forward, but if you can continue to take it forward, that would be great. And Mike, if you can raise it again at the next Council of Governors meeting to make stakeholder colleagues aware of what a concern this is for our citizens who are in this often quite desperate situations in overnight and at weekend times. Sarah, I think we've got some other questions. Is that correct, Sarah?
It is. We've got 2 submitted from Roger Lloyd. So the first is the increase in the mandated reports to NHS England creating detrimental pressures on the information governance team or the operational staff generally? I think Adam's going to answer this one.
Thank you, Adam. Adam?
Yeah, so I think it's important to recognise that with the national pressures the NHS is seeing, there is going to be a requirement for coordination of information and data across trusts. So I think it is right that we're providing data. Is it a burden at times? Yes, it is, and clearly we have to resource around that. But we do our best to minimise that workload, to avoid duplication, and to make sure we're providing the relevant stuff that we need.
Okay, thank you, Adam. And Sarah, you said Roger kindly put in a second question.
So Roger says, in view of the failure by UHCW to supply the information and data requested by the Chief Medical Officer at SWFT, as referred to in the minutes of 2 meetings of the Clinical Governance Committee, what further action can SWFT take, either with UHCW or the Coventry and Warwickshire Integrated Care Board, in order to ensure that SWFT patients transferred to UHCW are being treated in an appropriate and timely pathway? Charles is going to answer this one. Thank you.
Thank you, Sarah. Thank you, Roger.
Yes, the ICS are about to do a 1 year in review of the stroke service following the centralisation. and we had that insurance at Clinical Governance Committee. So they will get together all the outcome measures and do a review of the new service. But the stroke pathway is now managed in its entirety via UHCW, although we do provide the ward and the nurses for the patients that come back for rehabilitation at Feldon Ward, which is also does rehabilitation for other parts of the system.
Okay, can you keep us briefed and therefore members of the public briefed, Charles, once that review has been done? Glenn?
Yeah, Charles and I have had a conversation about this. I think as part of that review, we just need to be really clear on where the clinical governance arrangements sit for that pathway between us and UHCW.
Yeah. Okay, thank you. And any other questions for members of the public, please raise the digital hand. I can't see a digital hand being raised, so I'll just close the meeting with enormous thanks to everyone on the front line for their hard work. Christmas is coming. We've already felt a bit of that with the weather over the weekend, so take care, members of the public. Please don't be afraid to use a stick. Falling over when you get to a certain age isn't ideal, so don't be embarrassed to use a stick when you go out on a wet or icy day. And stay safe, enjoy the mince pies and a cup of tea at home, and have a wonderful Christmas. And Christmas is a very difficult time for people who are on their own. So if you're aware of a neighbour who is on their own or has maybe lost a loved one over the last year, popping in over the Christmas period is part of being part of making Warwickshire the type of place we all want to live in. So I'd really encourage people to do that. But in the meantime, look forward to seeing you at the next board. And for board colleagues, if we have a 10-minute break and then we'll get on to the confidential board. Take care, everyone. Thank you.
Thank you.